Hi everybody, my name is Lindsay Sommer and I am the Health Services Instructor at MICC. In this video we will cover a brief overview of what the Health Services students have been up to so far this quarter. So in this presentation we will talk about the Health Services Skills class and topics we've covered. We'll talk about certifications that the students have already earned so far this year. We'll give a brief update on practicum and what that has been looking like for students. And lastly, we'll touch on quarterly updates and when you can expect to receive those. In skills class this semester, students are with me 2 days a week, Monday and Tuesday morning at the MICC Careers Center. We've covered a broad variety of topics so far this year. Many of the topics that we've covered are foundational topics in health services. So these are things that are going to continue to show up throughout the year and in their practicum, and likely when they begin working as well. So topics we've covered include a brief intro to health services and the field, and some of the different jobs and environments it encompasses. We've covered a lot of safety in health services, so learning about the chain of infection and how to break that chain of infection. We've learned about personal protective equipment, how to properly put it on and take it off. We've learned about standard precautions and bloodborne pathogens. We've also covered HIPAA and confidentiality and what that means as employees in the health services field. We've talked about patient and resident rights. We've covered a lot of ambulation and learning how to safely and efficiently push people in wheelchairs and transport chairs in hospital beds. We've covered body mechanics to help keep ourselves safe as we're helping others. We've covered Maslow's hierarchy and patient communication. Some topics that we will cover for the rest of the semester include learning how to take vital signs. So we'll talk about taking somebody's height, weight, temperature, respiratory rate, pulse, and blood pressure. We'll learn a little bit about dementia and Alzheimer's disease and best practices for working with patients or residents that do have memory loss. We'll talk about different roles in the care team and the teamwork that happens in health services facilities. We will continue to talk about communication with patients, with residents, with coworkers and supervisors. We will do an overview of health insurance and learning a little bit about that world. And lastly, we will incorporate job exploration throughout the rest of the semester. So where available, we will go on tours to get an idea of what different jobs look like. We will do interviews. We will do interviews and question and answer sessions with people working in the field as well. Next, I'd like to touch on certifications that the students have earned so far this year. We've been keeping them extra busy on campus. Firstly, the students have all become certified in mental health first aid. This is a 3-year certification from the National Council for Behavioral Health. This certification required a lot of time and effort from the students. They all needed to work through a 2 to 3 hour self-paced material. So they were watching videos, reading, taking quizzes along the way. And then they attended a 5-hour live Zoom session to practice some of those skills that they had learned about. And all of them came away certified as mental health first aiders. The second certification the students have earned just last week is Basic Life Support CPR, so BLS CPR for healthcare providers. This certification is a 2-year certification through the American Heart Association. In this class, the students learned how to do CPR on adults, children, and infants, and they learned both 1-person and 2-person CPR. Students also learned the Heimlich maneuver and some basic first aid in this course. Through the rest of the semester, students will earn 2 more certifications. They will earn the Personal Care Assistant Certification, or PCA, and they'll also earn the Mandated Reporter Certification. Both of these are online certifications through the Minnesota Department of Human Services. Next, we will talk about practicum. So students are in full swing at their practicum at the VA Medical Center, where they are patient escort volunteers. They're at the VA 1 day per week for 4.5 hours, so we're building lots of stamina. In order to get started, students all went through volunteer onboarding, which was a process very similar to what they will do when they get a job next year. So they needed to go through to get background checks, tuberculosis tests and screenings. They did an interview, they went through orientation to make sure that they were fully prepared to start as volunteers. While students are there, they wear business casual attire, and as you can see in the pictures, they all have their blue volunteer vests that they wear to designate them as volunteers. While they are there, the VA has very clear safety procedures in place. Everybody in the VA is required to wear a mask, and volunteers also wear face shields for an extra layer of protection. At the VA in practicum, students are learning so many skills in the hands-on environment. They're learning a lot of foundational work skills, so things like punctuality, grooming and hygiene, responsibility, time management, stamina, and problem solving are present every single week when they go in. Students are learning how to navigate the VA and learn how to use the signs and the maps to get them where they need to go. They're learning how to transport patients safely. So students are responsible for pushing people in wheelchairs and transport chairs and in hospital beds. Students are doing a lot of patient communication and working on their small talk skills and their customer service. And lastly, students are learning how to do proper documentation. When they transport a patient from one place to another, they need to record the time they left and the time they dropped the patient off for each run. Some things to expect with practicum in the rest of the semester and through the rest of the year. Students will begin in the next few weeks taking public transportation back to campus after the VA. So they will work together to be practicing those skills of navigation in the community. And right now, students are all paired up with seasoned volunteers or staff members at the VA to learn their way around the building and to learn the ropes of how to safely transport patients. As students become comfortable, and this will happen at their own pace for each of them, they will begin to do patient escorts independently at the VA Medical Center. And the last thing I want to touch on in this video is the quarterly update. Quarterly updates are updates that I will write that are individualized to each student with strengths and opportunities for growth. These will come to you via Best Notes, and they will be portaled to you on October 2nd. So keep an eye out for that and check Best Notes for the individualized updates coming next week. And lastly, if you have any questions, email is the best way to get a hold of me, and my email is right there on the screen. Thank you.